Good afternoon and welcome to our first Facebook live chat here at John Flynn Private Hospital on the Gold Coast. In celebration of National Breastfeeding Awareness Week, I'm joined here by two members of our midwifery team. Our nurse unit manager, Galen. Welcome, Galen, this afternoon.
Thank you for coming.
And Adrian, a lactation consultant with the Ramsay team. So ladies, would you like to tell us a little bit about John Flynn and what we do for ladies breastfeeding here at the hospital?
Oh, I think for the first thing, we make sure that mothers are very well educated. I think that starts with antenatal classes, and it's really important that mothers get good education. It's important that they get continuity of information, and that they get staff that are educated enough to support them. So that's what we try to do here with those three.
Thank you, Galen. Sorry everybody, I did forget to mention as well, if you have any questions for our ladies during the next half hour while we are doing this live chat, feel free to pop them in the comments section, which I'll be looking at right here, and we will do our best to get them answered for you. Sorry about that, ladies. So we do get a lot of common questions come through from our mothers, but as well on Facebook related to breastfeeding. Do you find that you have a lot of common questions that mums will generally ask you, particularly first-time mums?
Oh, a lot. So we have a outpatient clinic here, mother and baby outpatient clinic for ongoing support with breastfeeding, any kind of infant feeding, sleep and settle, especially for first-time mums. So a lot of common questions are, how do I know my baby's getting enough milk? How do I prevent cracked and sore nipples? And how do I know how to settle my baby?
So how do you know if your baby's getting enough milk?
Well, so that's wide and varied depending on how old the baby is. So in the hospital setting, here we have a stay of anything from 5 to 6 days. So initially, you know that the baby's getting enough milk with a change in poo colour. And also you can hear a baby swallowing milk, even very small amounts of milk. Colostrum, which is a first feed, is a very small feed. But poo colour for the first 2 days is important. So baby's first poo is a meconium poo that's quite black and tarry. Mm-hmm. And then over 48 hours that's changing to more of a green, slimy, mucousy poo.
Right.
And then
Just a lot. And we even have a colour-coded chart.
The poo chart.
Oh,
love
poo chart.
Look into it. Just
Poo
for
chart's
dads. Dads
brilliant.
love the poo chart.
Yeah.
So by day 3 we expect a greater change in colour and change in how the breasts feel.
Okay.
So the breasts are feeling warmer and fuller. You can hear the baby swallowing more, and the poo's then changing from that green, slimy to browny to yellow. So a baby on 100% breast milk passes yellow, watery poo with seedy bits in it, and they usually do a lot of poos. So in the first...
Remember that?
Yeah, so really for the first 6 to 8 weeks, babies are commonly feeding up to 8 to 12 times in 24 hours, and they can do that many poos. So you would never have to weigh your baby then, because you know the baby's getting loads of milk because they're doing a lot of poo.
Okay.
If you can also hear the baby swallowing, so when the milk's coming in, the breasts are filling, the baby has more swallowing sounds. So initially a swallow sound is quite a light sound, it's a k sound.
Okay.
And you can see the baby's jaw move differently when they're taking in milk. These are the sorts of things that are worthwhile pointing out to a mum while they're feeding. Or you can see the baby's jaws moving a little bit deeper. So if that was the baby's jaw, they have these little fluttery sucks, they're bringing in the milk, and as the breast lets down the milk, that jaw moves more deeply. And just as the jaw moves deeply and it comes up, then you'll hear a k sound. And then as the breasts are filling, you'll hear more swallowing, you know, those sorts of sounds.
Okay.
So it can be wide and varied from the very beginning, the first 24 hours. Well, you know, the baby's not really getting a whole lot of milk because colostrum's only a small feed. But over time, with more feeding, the breasts will make more milk. And that's what's really important too. You know, you can't overfeed a breastfed baby in the early weeks, but you can get into the trap of underfeeding. So it's really important to feed a lot. The more milk you make, the happier the baby is. They do lots of yellow poo, you know, they're getting lots of milk, and you'll make more milk in return. So frequent milk removal is important. The more often the baby feeds, the more milk's made in return.
Okay, so then I would assume that the more you feed, the more likely you are to get sore and cracked nipples.
No, not
No.
necessarily.
Okay,
No. So the more you feed, the more milk you're going to make if the baby is attached well. So positioning and attachment, latch and attachment. Latch and attachment's the same thing, how much breast gets into the baby's mouth. And positioning is how you're holding the baby in the first place to come to the breast. So you can have a baby that's poorly attached, you know, perhaps the mum's got inverted nipples or very short nipples, or perhaps they're too large for the baby, you know, so making sure the baby gets a lot of breast in the mouth is important. So you cannot make a lot of milk because the baby is not attached well.
Therefore not drawing enough milk
Therefore the milk transfer is not enough. So if you have a baby that's attached well and is allowed to feed very frequently, then you're going to make more milk.
Okay. And how, if I was a new mum, how would I know how much breast is the right amount to have in the baby's mouth?
Well, and your question before about cracked and damaged nipples is really, you should never get cracked and damaged nipples, ideally. However, you can get tender nipples for the first couple of days, which is common. And a lot of women do describe nipple tenderness for the first 2 to 3 weeks. And you can keep feeding with cracked, damaged, bleeding nipples as long as they're not getting worse. And then it would be really worthwhile to see a lactation consultant or get some extra help. So initially it's a big deal for the baby to coordinate suck, swallow and breathing. It's a fine motor skill for the baby.
Okay.
And then depending on the type of delivery, that can make an impact on how well the baby feeds. So attachment is crucial. The more breast that gets in the baby's mouth, the more milk transfer, and in return the more milk will be made. So in order to prevent cracked and damaged nipples, it would be ideal to go through correct positioning and attachment for that mum right from the beginning. So here at John Flynn we do practice skin to skin as soon as the baby's born. If the baby's well and the mother's well, the baby's here on the mum's chest, they're not separated for at least an hour. If the baby hasn't had too much intervention, you know, they haven't had a long hard labour without epidural, ongoing with an emergency Caesar, and if everything is okay, usually the baby feeds quite well in the first hour. That first feed can often be quite good, but then after that, the baby often in the first 24 hours needs more assistance to get to the breast. So positioning and attachment. Positioning, for example, is how you're holding the baby in the first place to come to the breast.
And what's the ideal position?
Well, I have my baby here. Shall I show you?
Absolutely, thank you.
Just happen to have a prop.
Just happen to have a baby.
Oh, she's beautiful.
So correct, actually there's several ways that we do it. This position here is the natural position for feeding. This is the cradle hold, baby-led attachment. This is how we would picture ourselves feeding our baby.
Yep.
So if you've got lovely long erect nipples, this is an easy way to get the baby to the breast. Always roll the baby, tummy to tummy. Hold them just like this, tummy to tummy. Angle the nipple here at the top lip. If the nipple's not long and erect, make it long and erect, because babies love erect nipples. And the best way to make them erect is to do a bit of hand expressing.
Okay.
So if you do a bit of hand expressing or rub over your nipple, makes the nipple quite erect. You've rolled the baby right over, tummy to tummy. You just want to touch the nipple here at the baby's top lip. So if you're touching the nipple here and the baby's hungry, the baby instinctively lifts their chin. You want them to do a chin lift because then they can open their mouth really wide. So you've rolled the baby over, you're holding them fairly firmly, you're just touching the breast like this or like that at the top lip.
Okay.
The baby does a chin lift and you shove them on,
Excellent.
basically. Or
Okay.
you could allow the baby to do their thing, baby-led attachment. They might do a little bit of head bobbing around here until they launch themselves, which they do. They'll put their head back, find the areola, and then put themselves on.
Okay.
And the wonderful thing about this baby-led attachment is that the baby really does find their comfortable position, and so does the mum. And perhaps the mum can lean back a little bit in the chair.
Okay.
Some babies need extra help. So we will often show babies to go to the breast like this. So this is called mother-led attachment, really.
Okay.
So you're holding, and it's not natural, is it, for a new mum to hold their baby like this?
Correct.
No.
So babies, newborns, babies don't have postural stability. They're really floppy.
Hence why you have to hold the baby's
That's
head.
right.
Yes.
Well, yeah, well, not too much when you're feeding. That's what causes cracked and damaged nipples, actually, if you're pushing a lot on the baby's head.
Oh.
Because anatomically, the airway for the baby is very short.
Okay.
So the tongue is attached in here, it's very short. So if you're pushing the baby's head like that, they get really uncomfortable in here. So if you were to put your chin down and open your mouth, it's uncomfortable. For a baby, it's acute. They need to come like that, and then they can open their mouth really widely. So because the babies are really floppy and they flail and arms go everywhere, we will as mums, especially first mums, will have a tendency to hold the head and sort of direct them and be going like this, which is fair enough.
Yeah.
But you can be pushing the head forward, and that can create damaged nipples, especially if a mother has a graze or a crack right down the middle of the nipple. That means there's too much pushing on the baby's head. So they need to bring their fingers around the baby's neck, hold them firmly under the breasts and on top of the tummy.
Under the breasts and on top of the tummy. Okay.
So you know, just after you've had a baby, you still have a bit of a post-pregnant tummy.
Yes.
That's nature's pillow. It does go away eventually, but that's where you tuck them.
It's a beautiful way to look at it.
Under the breast and on top of the tummy. And then aiming the nipple around about here. So the nipple's there and the baby instinctively goes like this. So the nipple goes from here to the roof of the mouth. It all sounds very technical, but actually, if you kind of watch your baby and roll them over chest to chest, just that position, tummy to tummy, is enough to set off all the cues and reflexes for the baby to get
all
on.
the natural instincts.
All the natural
Babies
things.
just do it naturally.
And they will do it naturally. But, you know, damaged nipples are a big issue. And I think nobody really talks too much about the problems with breastfeeding.
And we
but
should.
sometimes it can be hard to get started.
It can, certainly. I know it's very difficult for some women to really embrace breastfeeding because it can be a nasty journey.
And
Well,
it's
If
for
everything
them to
doesn't
ask
come
for
well.
help as well. There's
Yeah.
quite a few mums that try to do it all on their own, they've read all about it, but they really do need to ask.
And
that's
it's
what-
not
that's
a
what
fault
we're
of
good
the
at.
mother, I think, is the
No.
biggest thing. It's
Just
just
ask us for
sometimes you
help.
just need help.
Yes.
Sometimes you do. And also remember, it's between two people. So it's me as a mum, and it's what the baby's doing. And sometimes it's, you know, you're doing everything right, everything possible to do everything right. And the baby just, you know, sometimes they take a little while just to really get it together. They really do. So we need to be patient with our babies as well. And I truly believe that if mums who are struggling with their breastfeeding get that right advice at the right time, it makes a world of difference because, you know, about 98% of breastfeeding problems can be easily solved just by seeing a health professional, which is part of what we do here as well.
Yes,
Remember,
so-
our mother and baby outpatient clinic, which is ongoing support, not just the hospital stay, but it's ongoing for after you go home.
So, talking in the hospital stay then, Galen, at what point do you call in someone like Adrian for a new mum who's, say, in her second or third day and is having trouble?
Okay, most of the staff, like you'll find that the staff here are all educated, they are baby friendly, we give consistent advice, and what we do here really well is to make sure everyone gets the same education, and that is the staff first.
Okay.
So the staff are educated first, they are always doing update with breastfeeding education, seminars, getting the same information, consistent advice is usually what prevents most of your issues because mothers don't get confused. If you make a plan, follow it. If there's any issues that we really need a lactation consultant for, then we have them on staff. There's a lactation consultant on every day.
Okay.
So
There's
we
quite a
have
few of us
lactation
that are
consultants,
qualified.
but
Okay.
most of you'll find that the staff here are qualified to deal with lactation problems. There are
Okay.
lactation consultants that deal with the extra problems, which
The
are
more trickier.
just those little tricky issues that some mums have. And what we do well here is we stick to the plan. If we have a plan for mothers, then stick to one plan until it needs to be changed.
Okay.
Because you find chopping and changing a breastfeeding plan can be more confusing for the baby than it is for the mother.
And yeah,
that's
we
what
all
we
know.
try to do. Yes.
You do get, when you
And
get
everyone's
different
tired,
advice,
conflicting
very
advice.
difficult. Yeah.
And that's what we work hard here for, is to get consistency and to have one-on-one care for mothers. Sometimes you find what works for one baby doesn't work for the next. And what I try to do is I see the mums most days. I can't say every day. Some days I get a little bit busy, but generally most days. And I check that the information that they have, the education that they are receiving and following up is being done.
Excellent.
Because sometimes you find there might be some that have fallen by the wayside, and what we need to do is just make sure that those that do need that extra help get it. And
That's very important.
That's what's really important here, is making sure that mothers get help, especially in the first 2 to 3 days. If you start off well, it's just brilliant. And we are really passionate about breastfeeding.
So say everything goes along swimmingly,
Yes.
you can breastfeed exceptionally easily, and you get to say the 5-month mark and it's time to go back to work. What advice do you have for mothers who are going to move from exclusively breastfeeding to expressing?
Well, I would say earlier than that, if a mum knows that she's going to be going back to work earlier than expected, and she knows that much earlier on, so if she knows that when the baby's born or in those first 6 to 8 weeks after the baby's born, it would be worthwhile introducing a bottle of expressed milk earlier.
Okay.
So a baby that's breastfed only, by 3 to 4 months of age, they're not going to take a teat. They won't have it.
Right.
That's how clever they are. They won't have it.
That's what starts the problems.
And it can be very, very tricky. But they can
Okay.
drink from a cup. 4 months they can drink from a sippy cup really well. They can drink from a straw. They can drink from a small open cup. They can drink from a pump bottle or a little, pop top quite easily. But and a lot of mums do know already, they know, look, I've got to go back to work at 4 months or 5 months, or they might have to go back, they run their own business. So someone we've had recently runs her own salon. She really had to go back a couple of days a week from 6 weeks. So from 3 weeks, she was expressing once a day to get some extra milk.
Get the baby
and
used
to
receiving the teat.
Have the baby used to receiving a teat. So if it's at that 5-month mark, perhaps they'll introduce a teat earlier, so perhaps at 8 weeks.
Okay.
And get someone else to do it, so dad can do it, or nana, or someone else does that teat feed, because the baby will be looking at the mother going, are you crazy, putting that teat in my mouth, we're supposed to be at the breast.
Yeah.
So with that, if she expresses earlier on, so she knows that in 2 months' time she's going back to work, if it's full time, that's quite manageable. She'll need to get a bit of a store happening for the first day back at work, and also having a work-friendly, breastfeeding-friendly place. So that's a big thing.
Somewhere to go and express throughout the day.
Yes.
How often should she expect to be
So she may, at 5 months, she may or may not have introduced food yet. It depends. It's a kind of quite a very broad question, actually. So perhaps she's expressing 4 times or 3 times at work, and she might breastfeed the baby before work when she gets home. And perhaps the baby needs 3 bottles during the day, or probably 3 bottles during the day. So if she's able to express 3 times at work, so really she needs to be able to negotiate that with her employer. And some of the bigger institutions have great breastfeeding policies, like we do here at Ramsay. They're entitled to a lactation break that's reasonable, 20 minutes, half an hour. So. And you can pump anywhere at any time. It's like breastfeeding. Breastfeed anywhere, anytime. And the moment anybody tells a woman that they go to the bathroom to express or to breastfeed, that's completely inappropriate, because we don't go and have our lunch in the toilet. So it's the same for the baby, or for mum's pumping. Hopefully in an office situation, she's not have to sat with her back to the rest of the office. She's got somewhere a little bit private to pump. And it's not really appropriate to tell women, just go out to your car and pump out there, that sort of thing. That's not really appropriate. No. And that happens. It happens a lot in a lot of workplaces, so not in the bigger Queensland Health and those sorts of places. Gold Coast City Council have a great breastfeeding policy. So it's something that's definitely worthwhile bringing up with your employee. But it's doable.
We're very lucky here at Ramsay. We'll
Yes,
just
we
have
are.
a quick look on the Facebook page and see if we've got any questions on here. Okay.
Probably better types of pumps.
So what type of breast pumps would you suggest? Like a woman who is in the market for a breast pump, what should she be looking for?
Well, we're without promoting any brands, of course.
Of course, yes.
There are some really great reviews out there, so I would suggest reading all your reviews.
Okay.
There are some great mini electric pumps out there as well that aren't expensive, but probably one of the key things would be being able to have the diameter, this is called the flange, where you put it on,
Yeah.
being able to have small, medium, large,
Adjustable?
So they're adjustable.
Make sure it fits. It's
Make
really
sure it
important.
fits.
Okay.
Also that the vacuum, so how hard the pump sucks, can be adjustable.
Right, okay.
So there are some brilliant brands out there. It's just a matter of doing the research and reading the reviews.
Okay.
I think everyone's good at doing that these
Yes,
days.
certainly happening a lot now.
Yeah.
That's for sure.
Yeah.
Okay. All right. Let me just have another look here and see if we've gotten any further. Now, what about when you're ill? If you have a cold or flu, should you be stopping breastfeeding as you are transmitting it through to the baby?
No,
No, absolutely
Never
not.
ever.
Absolutely not.
never. So you could have the flu, you could have, measles, mumps, rubella, whatever you've got. You could have an infectious disease.
Really?
You
And it
don't-
doesn't affect the breast milk at all?
You continue to breastfeed. So the benefits of continuing to feed the baby far outweigh anything else. And in fact, you are passing on a degree of passive immunity to the baby to continue feeding.
Wow.
So
Okay.
it's important. So let's say you've got, gastro, or you do have a flu, or you've got a head cold. Perhaps you wouldn't kiss the baby around their mouth. You wouldn't cough over the baby. Washing hands is the best way to prevent coughs and colds. Always wash your hands.
General hygiene
Yeah.
is always important.
really
Continue to feed. And if mums are concerned about that, there are some really, great helplines with that. And of course, they can always come here and talk to us about it as well. But we do promote continuing to feed the baby. It's
Fantastic.
very rare.
And that also includes mastitis. We get a lot of mums in with mastitis.
Which can be very
Yes, it can be
painful.
very
in feeding.
painful, and a lot of the time they're actually told to stop feeding.
Okay.
Don't stop breastfeeding.
Yeah.
Just continue to breastfeed.
Push through.
Just push through.
Okay.
And,
through
sometimes
and get
women
help.
are told, suggested not to feed while they're taking antibiotics.
Yes.
It's very important to continue to feed. So, minuscule amounts of antibiotics will pass in the breast milk, minuscule, but it's far more beneficial to the baby's health and their immune system that they're continuing to receive breast milk.
Right.
So there really are very few instances where, you must stop breastfeeding, and most medications are fine to take.
And if you do stop, your milk will often dry up, as they say, fairly quickly anyway.
And often
can
weaned.
do. Yeah.
Okay. All right. Thank you. So, lastly, before we wrap this up, foods to avoid. I know my mother always said to me when I was breastfeeding to avoid cabbage at all costs. Is that an old wives' tale? Are there particular foods you should avoid? Or
You're right for me
foods?
to answer this one.
Go right ahead.
There should not be a list out there anywhere about what not to eat.
Tear it up.
Fantastic.
A breastfeeding woman needs to eat well. So the guideline is everything in moderation. Don't
Okay.
overdo any one thing. So have one or two Tim Tams, or have the top row of chocolate, but not the whole block.
And have good quality chocolate.
Have good quality.
Don't have the rubbish, have the best
And
quality
is that
chocolate.
actually health advice, or is that
Well,
just because you
you
should
know,
always
have-
have good quality chocolate?
Always have good quality
Yes,
chocolate.
yeah,
But
actually
that,
the best.
have a treat, and when you're tired when you're breastfeeding, so sometimes you do need a little bit of a treat. But everything in moderation, eat well. And it's interesting, some new research about your omega-3s. So omega-3s, which is a very healthy oil found in eggs and fatty, oily fish. If you have a diet that's high in omega-3s, you are going to have a higher fat content in your breast milk, which is more soothing to the baby's gut and
And
keeps them
helps
fuller
them
for
gain weight
longer.
as well.
So everything in moderation.
Omega-3s.
And
Thank you,
omega-3s are
that's
good.
great advice.
And that's in food, not in medication.
Not in
in food.
medication. Okay, in food. So lots of fish.
Yes, lots
Okay.
of fish.
Well, thank you, ladies. Is there anything you would like to add this afternoon, or any particular advice you have for mums we haven't covered?
If you want help, ask for it. Don't be afraid to ask.
Mm.
Honestly, that is the secret.
That's
Because
great
most,
advice.
most people are trying to do it on their own. They've read everything. Just ask us.
Because
That's
you've
what we're
probably
here
seen
for.
it all anyway.
We have, Feel free
Okay.
to ask us anything. And feel free to ring us if you
Okay.
have any issues.
Well, I think that's all we've got time for today. Thank you very much for joining us. We will be posting this up to our Facebook page as well as onto our website. and any other podcasts you may have ideas for, please let us know. Thanks very much, everyone. Thank you, ladies, for joining me today.
Thank you.
Thanks.